Today, the EVSC is announcing that we will delay the start of school this year for 2 weeks. So instead of beginning school on Wednesday, August the 5th, we're now going to begin school on Wednesday, August the 19th. In essence, what we're doing is we're picking up the calendar and moving it back 2 weeks. We will adjust some of the dates within the calendar, but as it stands right now, just for clarity purposes, we are still going to have 180 days in our school calendar. We're just simply delaying the start of school for 2 weeks. Why the adjustment? Well, we've said all along when we announced our reopening plan that we've been working on since May. When we announced that plan in June, we said that we will continue to make adjustments as necessary to the conditions that Vanderburgh County faces at that time due to COVID-19. Well, unfortunately, just since July the 1st, we have seen an exponential explosion in the number of positive COVID-19 cases in Vanderburgh County, growing to 582 according to the Indiana State Department of Health's website in just this portion of July, from July 1st to July 17th. That's 582 positive cases. Additionally, the positivity rate now is hovering around 10%. Before, in April and even in May, that positivity rate was very, very low, around 1 or 2%. Certainly, this is clearly a cause for concern. In a conversation that I had with Dr. Box, who's the state health commissioner, and other superintendents had in the Indiana Urban School Association earlier this week on Tuesday, she indicated that if you have a positive rate of about 5%, then you certainly should, that's cause for concern. But when it grows to 10 or 15% and you cannot trace it to a single source, then certainly that is cause for concern. So I stand before you today basically to express the concern that we have, and I've said numerous times that the success of our reopening plan and every reopening plan in Vanderburgh County is going to be dependent upon the success of Vanderburgh County in making certain that we slow the growth or making certain that there is no growth in the number of positive COVID-19 cases. Other leading indicators that we're very attentive to are the active cases that we have. That is now, according to the Vanderburgh County Health Department officials, in the 400+ range. So all of these stats are very, very alarming, all these leading indicators, as well as the leading indicator of individuals in the age span of 20 to 29 now make up 1/3 of the cases in Vanderburgh County. And I hope and pray that the lagging indicators, the hospitalization in terms of ICU, in terms of the ventilators, and in terms of deaths, I hope those lagging indicators don't mimic what we've seen in our leading indicators. But if they do, then I guess I'm just using this platform right now to implore residents of Vanderburgh County to take the steps necessary to reverse the trajectory that we've seen. There's an official from the Vanderburgh County Health Department that I think said it very, very well. It's not the practice in the four walls that you need to be concerned about here. It is what's going on in our community. And what is going on in our community is preventing us from opening school when we anticipated opening. This tells the story. When we announced the plans in June, this is where we had been running. From July 1st to July 17th, 582 new cases of COVID-19. So I apologize for parents that have to once again disrupt their family life and make plans for their students to stay home, or to make certain that they have care plans for their students, because I know that's incredibly difficult. I implore our parents to continue to be nimble. We don't know what this year brings. But it's important to note that we cannot do this by ourselves. And I want to go back to the statement that it's not the practice in the four walls. As many of you know, we've had athletic teams start up in the past week since July the 6th, as well as some of our marching bands. All the mitigation strategies that we've deployed for them have worked. They've had practice very, very, very successfully. And certainly it helps that they're outside. but we do know that the strategies that we've deployed works. What we also know is we can't do this by ourselves. I do want to take this opportunity to let folks know that those extracurriculars will continue. We will continue to monitor, and in the event that things start to change, then we will change our course of action also. Also want to certainly thank our healthcare professionals. Was on the phone with St. Vincent and Deaconess. They have been phenomenal in their support of EVSC and schools and families and this entire community. But please, please help us. Please help us. We're ready to go. This is what we've undertaken just in terms of PPE equipment. We have 200 sneeze guards for our receptionists and secretaries. We have 10,500 face shields, 412,000 surgical masks, 52,000 cloth masks. We have 10,000 N95 masks. We have 49 foggers that have the capability of eradicating the coronavirus in 1 minute or less. We also have hand sanitizer bottles, 3,500 that are refillable. And then we have clearly the social distancing decals, and we also have the touchless water bottle fillers so kids can stay hydrated in schools. We also, as you know, uncovered yesterday that we moved an entire school out of a building so that we could safely practice social distancing with our 4th and 5th graders in 2 of our largest elementary schools. I want to assure the community that we've taken the steps necessary inside our 4 walls. Those steps also ensuring that our schools have a full-time nurse every minute that students are in our buildings. And they're a critical part of a COVID-19 team that each school has. But we cannot do this work by ourselves. So I'm imploring the community, do what you know needs to be done. Practice social distancing, wear a mask, thorough and frequent hand washing, and make certain that you continue to sanitize and clean and disinfect those high-touch areas. We can get through this together. And I know there are dangers of not going to school. I also know there are dangers if we go to school. We've taken the steps necessary to mitigate our exposure to those risks inside our buildings. Once again, we cannot do this by ourselves. With that, I'll be happy to answer any questions you may have.
Dr. Smith, you mentioned the 180 days of instruction for the school year, despite the 2-week delay. So can you tell us how the calendar's been changed to make sure that instruction time is getting in?
Certainly. So when we talk about the 180 days of instruction, that is a requirement in the state of Indiana. So we, in essence, have lifted the calendar up, moved it back 2 weeks. We will also continue to make some adjustments internally. We may shorten the fall break a bit and make other modifications. I don't want individuals to think that we're going to go well into June, because I also know that we will need a break from this next year, hopefully when we have the herd immunity. We also have a vaccine that's very effective, hopefully very, very soon, but people will need their space next summer to decompress. So what we're basically doing is picking up the calendar 2 weeks, moving it 2 weeks back, and then we will compress a little bit, but I am fairly confident that we will go into the early part of June. We will certainly work with our employee groups and then work with our Board of School Trustees, who have been phenomenal through this, and they will approve a new calendar very soon.
So to follow up on that, there could be changes with fall break or maybe Christmas break or an extended period of time?
There could be.
Dr. Smith, with the school date looking to start on August 19th, will kids be in the classrooms? Are you looking to have in-person education at that time?
Yes, when we started working on our school reopening plans back in May, we knew that it was very important to provide options for our students and for our families. We've been guided really by 3 principles. First of all, the safety and well-being of our students and staff. The second guiding principle during this reopening and recovery phase is to make certain that our parents and our students had options that fit their specific and unique needs. And then the third very important guiding principle that really brings us here today is collaboration and cooperation. As I said, I realize that this is a hardship on our parents, and I apologize for that, but no one really wants to be here. Specifically to your question, we will still have those two primary options, learning in class, following the guidelines and precautions of social distancing, as we've already laid out, and then also our virtual academy. When school starts, then we will also have that remote option, because we do know that there will be a number of students because of COVID-19 or what's going on in their family that may need to have the opportunity to have that remote instruction for a period of 10 to 14 days or perhaps a little bit longer. So I hope that that answers your question. It basically, we're not canceling any part of the school year. We're not starting virtually. We are starting with a plan that has been laid out for those 180 days.
Dr. Smith, are there any plans in the event that a teacher, staff member, or student gets sick or exposed to the virus?
There are absolutely plans, and we are following the guidance of the Indiana State Department of Health as well as the Vanderbilt County Health Department. So we have those protocols. I think this is a good opportunity to let everybody know that we will release early next week our very comprehensive school reopening plans, and then following that in short order will be each individual school reopening plans that will be tailor-made for the unique circumstances that each school faces. So those plans will be forthcoming. I can tell you, though, that if an individual tests positive for COVID-19, that then there is a specific period of time where they have to self-quarantine, and all of those really have been, I think, widely publicized on the Vanderbilt County Health Department side as well as the Indiana State Health Department site.
Dr. Smith, I know you've outlined some of the PPE plans, but for some students, they may benefit better from an in-person education, but may also have some sensory issues or special needs. In some cases, kids may be running around younger, take off their masks, may not know better. So for all the planning in the world, how do you want to address these sort of individual on-the-ground issues as they arise?
So for individuals, because this is going to be a new dynamic, it's difficult for people to have a schema of what school looks like, because everything will be, or not everything, but many, many things will be different. So specifically to that point, on August the 19th, the 20th, and the 21st, we will bring in half of our students according to the alphabet. So the first half of the alphabet will go Wednesday, Thursday, and Friday, the 19th through the 21st of August. We then have the weekend break. The second half of the alphabet then comes in on the next Monday, Tuesday, and Wednesday. And then on that Thursday and Friday, all of our students will be in attendance. The reason for that is exactly what you lifted. We want to make certain that our students get accustomed to the practices and the protocols that we put in place, because it is different. In terms of social distancing, I have complete confidence that our students can rise to the occasion. We have evidence of that in our athletic teams and our marching bands. They've done a phenomenal job, and I know just given the opportunity that all of our students will be able to do that. I also understand that young students love to show their affection to others. So we will take the appropriate steps necessary. We do have the N95 mask for teachers of primary grades, because that is that's an outstanding protective device for the teacher, as well as teachers will be able to also have the face shields. So we have put in place things that will protect our students as well as protecting the adults that are so vital for the success not just of our students, but the success of our entire community.
Dr. Smith, what about the ramp students? We heard that they were expected to report in the coming days. Will that be pushed back 2 weeks, or will they also return on the 19th?
We anticipate them returning as originally planned. They're a special and unique branch of EVSC, and our friends at AmeriQual have done a phenomenal job of putting things in place that keep their employees safe. In this instance, these are not only our students, they're also our employees. So we feel confident that they will continue to go to ramp program as earlier indicated.
In regards to ISTEP, will students get less time to prepare for that test because of the pushback?
ISTEP is not my concern. My concern is the well-being of our students, and it has always been the concern of this corporation and our school board. I understand that ISTEP is important in terms of it is a snapshot in time and one aspect of a student, but we have a phenomenal program of educating the whole child. So if we have less instructional time dedicated to ISTEP, so be it.
Dr. Smith, following up on that, are you concerned about students being able to receive the same quality of education that they received before the pandemic with these new steps in place?
I'm very concerned about students being able to get a quality education in a pandemic. There are things in my control and there are things outside of my control. What is outside of my control is the pandemic and how the community responds. I can, to a certain extent, control the kinds of safeguards and measures we put in place while our kids are in school. It is vitally important for the success of every student that we return to in-person instruction so that they have that high-quality, caring teacher in front of them. That, hands down, is the best way to educate any child. I also know that in weighing the risk of going to in-person instruction, there are also risks of kids not returning to school. And when we have this exponential growth in positives of COVID-19, then that risk of in-person instruction outweighs the risk of kids staying home. That's why I'm imploring the residents of Vanderbilt County, please do what you know you need to do to keep not only yourself safe, but also everyone else in the county safe.
Have you spoken to any other local school districts, school corporations, or even similarly sized school districts and school corporations across the state?
We do have good relations with many other school districts. We are very unique in southwestern Indiana in that our size basically is that of everyone else in southwestern Indiana combined. So we don't share a lot in similarities. But I will tell you, because of our size, we're able to offer full-time nurses in all of our schools. We're able to make certain that we do this. We're able to make certain that every student can go to school in a school that we've set up for social distancing. I feel very comfortable and confident in saying that. I do know that there is a movement that started out of Indianapolis of having virtual instruction for the entire first semester. That pains me because individuals, when we talk about the achievement gap and when we talk about matters of equity, all that does is widen that gap, and those that need our assistance the most then are kept once again away from our help and our assistance. So that's troubling to me. That's why I think when people say that there's only a risk when you are in a brick and mortar setting during COVID-19, there are obviously risks when you are not in person also.
Is there a contingency plan in place in case numbers continue to trend upward versus coming back down?
There definitely are, and we will also be doing a Facebook Live presentation, I believe, next Tuesday, and we will go through our reopening plan page by page by page. So I would make certain that everyone is attuned to that. I don't know that we have a time for that yet, but we will let everybody know our contingency plans as well as the metrics that we use to decide basically in what level we are in. Just as a bit of a sneak preview, we will have levels of operation, green, yellow, and red. Certainly red is everybody is at home. There is no in-person instruction. There's no extracurricular activities. Red would be as basically we had last spring. Green would be opening with the options that we've already presented. Yellow then would be that stage in between, and it would be based upon active cases as well as positivity as well as growth in positive cases of COVID-19. And that then would be perhaps a rolling school closure. So we might close an elementary school or middle school or high school depending upon what that particular zip code and what was happening within that school, as well as other strategies.
Dr. Smith, you mentioned a couple of factors that went into calculating the new start date, and one of the ones that I was curious about is about 3 weeks ago, there was a petition that was started online by EVSC parents. Right now, that stands at 1,894 that wanted the school date pushed back. Did the parent feedback factor into your calculus for the sale?
Parent feedback is always very, very important to us. That particular survey did not factor into our decision because that was undertaken 3 weeks ago. What impacts our decision is this. Clearly, when I talk about collaboration and cooperation with parents, that's what I'm talking about. We certainly listened to that, but at that point in time, this is where we were. I understand and appreciate the apprehension and the anxiety that is out there. I clearly understand that. Can you imagine what it is now? Once again, I'm imploring the residents of Vanderbilt County, please do what you need to do in order to make certain that our businesses can stay open, our schools can open. It is really the personal responsibility of everyone that lives or works within Vanderbilt County.
Dr. Smith, the last time we heard from you or the last time I heard from you, you mentioned the cost of the mask, saying that, the school system is expecting to spend more than $1 million on that. Do you have a rough total of all the PPE bought to date?
I don't. I can get that for you. And specifically on that particular, I think it was about $1.2 million at that time of purchasing a mask, surgical mask for every student, every staff member for all 180 days. I will tell you that we have added $1 million worth of staff, and the PPE equipment that you've seen is, is not inexpensive. At this point in time, cost is not my primary concern. We'll deal with the cost later. My primary concern is that first guiding principle, the safety and well-being of our students and staff.
I want to make sure I heard you correctly. You said added $1 million worth of staff?
Of staff, of just staff, not even taking this into consideration.
Will there be any form of payment for employees while they're away from work longer than they anticipated?
Every employee received full compensation when we were closed through the governor's executive order. We certainly anticipate doing that moving forward. I will tell you that private schools and charter schools were part of the organization that could receive loans. Public schools were not part of that for whatever reason. So I'm simply saying I want to assure our employees that yes, you will continue to be paid, okay? But I also want everybody to know that it continues to be a struggle and a very big concern. Not the dominant concern. The dominant concern is the safety and well-being of our employees and staff and students.
Dr. Smith, and that's for extracurricular activities. You mentioned that our EVSC football programs, are those going to be pushed back as well as, along with the start date being pushed back as well?
Right now, our practices for extracurriculars are primarily being are outside, as well as the mitigation strategies that we put in place. We will continue to monitor those. We will see what we need to do, as if conditions change within the teams and within the extracurriculars, then we'll take the appropriate steps necessary. I think you also have heard that the Indiana High School or the Indiana Music Association canceled the marching band season in Indiana. I think you probably know that Indiana and Texas are two of the biggest states for marching band, and we have incredible groups here. So for that governing body to cancel the season, I think also makes a statement that there's some grave concern out there. I know Vanderbilt County can do better, and we will.
Dr. Smith, you've spoken to the physical health of students and teachers, but I was wondering if you could speak as well to the mental health of students and teachers. This pandemic has obviously put a lot of stress on a lot of folks, included. So would you speak to what you all are focusing on with mental health?
Certainly. So for social emotional health and well-being, as well as mental health, not only for students and not only for staff, but also for parents as well. I believe you know that EVSC is a leader in that arena, not only locally, but also nationally through our approach to educating all students through GAIN. If you were able to watch any of the programming that WNIN was so graciously put on their channel that was teacher created, every lesson started out with a calming exercise, because we are very, very attentive to that. I'm here to tell you that students will not learn if they are in an elevated state. If they're not calm, alert, and ready to learn, then educational processes really can't take place. And the same is true for adults. We probably have all snapped because we're just frazzled emotionally. So I would encourage anybody and everybody to try to do what they can to decompress, to step back, and to make certain that they are able to once again have that self-regulation that's necessary to be calm, alert, and ready to learn.
Dr. Smith, as leader of the school corporation, what message do you have to educators going into August 19th?
I've heard from numerous educators, they are ready to go. They want to be back in the classroom with their kids. They are passionate about the work that they do, and they serve our community so well. I also know that they're concerned. Once again, I'll reiterate the point that the Vanderbilt County health officials made to us. The concern is not what happens within your four walls. The concern is what happens out in the community. That's why I am standing in their place, imploring the community to please do what you need to do to make certain that we stop the spread of COVID-19. I don't know how I can say it any other way. Our teachers, our staff are phenomenal human beings, but they also deserve to be protected. I'm asking you to wear masks, to wash your hands, to protect everyone in the community. Please, please do so.
There might be some parts of the curriculum that might be harder to socially distance, for example, say gym class. Are there plans to try and enforce social distancing? No. You know, kids are in the gym and playing basketball, for example. How could you enforce social distancing with that?
Certainly. So gym will look different, as will nearly every other class. So when we think about the sterilization, disinfecting of the athletic balls that are used, be it a soccer ball, whatever, those strategies are deployed and will be deployed in our schools. We may not be playing basketball in gym class as folks typically would, but there are a lot of non-team sports and activities that students can learn and can utilize. And I think this would be a perfect example of learning those kinds of non-team physical activities. We're blessed. A lot of gym classes take place outside or take place in a large gymnasium. So social distancing is more easily accomplished in that arena.
Have you spoken to the head of the teachers union before making this decision?
Yes. I also want to lift my appreciation to ETA and the leadership of ETA. We have been in constant communication since this began, and I think they understand the difficulty that everyone faces here, so I appreciate their leadership, and I had a phone call with Mike Rust, the ETA president, just this afternoon. As well as we talked to Teamsters Local 215, Rick Voiles. Thank you very much. Appreciate it.